This is the Algiers Family Health Center, and we are located on the west bank of New Orleans. It is a community that's fairly large in size, and because of the Mississippi River, it is sometimes thought to be disconnected, but it's still very much a part of New Orleans. Because of the Mississippi River Bridge, a lot of the residents have difficulty navigating from this side of the river to the other, so that we like to think that we have all the services that they need to receive excellent primary health care right here in this particular facility. We are currently operating 4 facilities in New Orleans and in Baton Rouge. This particular facility, the EXCELth Family Health Center Algiers, on the west bank of New Orleans, the EXCELth Family Health Center in Gentilly, which is the midtown part, just a little to the east of the center of the city of New Orleans. In fact, is one of the earlier recovery zones for New Orleans after Hurricane Katrina. We also operate 2 facilities in Baton Rouge, one providing dental care, one providing mental health services. And we also have a dental facility here in New Orleans on the West Bank, again in Algiers, which is providing dental services to the underserved in this area. Our goal is to provide patient-centered medical care, both preventive and primary care, and to what we believe is to be the family. We believe that we provide access to anyone who needs care. We are targeting specifically those who are under 200% of the federal poverty level, but I believe just to think about the common working person, those who may have Medicaid or Medicare, those who have no insurance at all or may have some private insurance but do not have sufficient income to pay for their full deductible or co-pays. We are specifically targeting those particular patients as meeting their need and providing quality primary care, behavioral health, and dental care. If it were not for this clinic and some of the other facilities that we are operating, many patients would go without care. They would prolong the absence of treatment. They would not have resource to take care of some of their urgent needs. They would not get their annual preventive checks. They would not receive dental care. They would not receive behavioral health services, perhaps for depression or PTSD or some other needs that they may have, because of the fact that they would be concerned about the cost or the fact that they may be somewhat isolated, ostracized, or there may be someone who may have judgment in terms of their need. Our facilities are meant to be open and to be comprehensive and to not only look at their immediate need when they walk into the door, but their long-term needs in terms of what are their whether they're aged, they're young, whether they are male, they're female, because of the different lifestyles which they may lead. We are still open to them and seek to meet their needs.
Hey, hello, I'm Dr. Shalaby. How are you?
Hi, Doc.
How are you doing today?
It's okay. I think I have a bit of a sore throat today.
We have all kind of primary care service. We have pediatricians, we have family physicians, we have internal medicine doctors, we have OBGYN doctors, we have ophthalmology doctors, we have psychiatrists, we have podiatrists. We have a whole team of primary care and we have a dentist also. So we have a whole team of primary care physicians.
What kind of results have you seen from the patients in the years that you've been here?
It's wonderful results. The patient is totally dependent on us, and we make it their medication available for them. They get full kind of service. We have a huge population of diabetics. No less than 1,000 diabetic patients come to the clinic here, and they've been with us for years for all of the results they get from the clinic.
My name is Reed Doster. I coordinate behavioral health in 3 clinics, Algiers, Gentilly, and Baton Rouge. We treat people with depression, anxiety, those suffering from post-traumatic stress disorder syndrome, and also complicated bereavement. We also use, as one of our tools in treatment, telemedicine, which you see equipment right behind me, and we're able to communicate by what we call telehealth among all three of our clinics. And this is very convenient for our patients, and it helps us to maximize our resources. So you can be at a remote location in another clinic, and yet one of our therapists can be talking with you, and the patients say that they enjoy it and they're not intimidated by it. So this gives us more flexibility in helping people. We see excellent results from the use of telemedicine. At this stage, it's mainly our psychiatrists doing medication management sessions, and then our social workers providing psychosocial assessments. We don't do a lot of marital or family therapy using this medium, but we find that it's equally effective, surprisingly, to face-to-face, in-person, in-the-flesh sessions.
My name is Barbara Dehan Manuel, and I'm the Social Service Coordinator for EXCELth, and I've been here for 17 years now. I head up the Social Services Department, and in the Social Services Department, we offer case management services where we get the patients connected to community resources, and that's housing assistance, emergency assistance, as well as we do medication assistance, and this is where we provide easy access to chronic disease medications for little to no cost. We're also responsible for eligibility services, and that's where we do NOKI services. That's the Greater New Orleans Community Health Connection, and it's the Medicaid waiver program, and this program helps to cover medical costs for patients when they come to NOKI eligible sites. We also help patients. My department is also responsible for the implementation of the Bayou Health Plans, the new Medicaid, and we help with linkage and enrollment. As well as my department is also responsible for interpretation services. We have an Arabic employee on staff, and she provides translation for Arabics and the Hispanic population. The goal of my department, and that is to help patients become self-sufficient. And I think one of the main things we've seen is that patients are learning to advocate for themselves and become self-sufficient.
Before this clinic opened, I don't have any regular doctor, and I don't know where to go. So when this clinic opened, I came together with my husband because we're looking for a regular doctor. And that's what I find out, that I have a blood pressure problem and cholesterol problem. The care that I receive here in EXCELth is excellent, and all the staff are wonderful, especially the doctor that care for the patient, compassionate, and I don't know where I can find that care. The value of this clinic is very important because some of the patient or some of the consumer don't know where to go, but this clinic is very help a lot of people, especially my family, all my relatives that has a problem with their health. So the clinic is very helpful with all the community that lives here.
When I first started coming, I was getting care for my diabetes and high blood pressure and cholesterol. Oh man, the best care I ever had. Awesome with Dr. Shelby. Couldn't be a better doctor in that. He was great. Well, if it wasn't been for this clinic, Lord knows, I probably would have died.
Dr. Shelby is an awesome doctor. My husband and I see him on a monthly basis, and after the accident, my husband continued to see him, and I continue to see him. He is the best doctor that we've ever had, right, Don? And awesome doctor. Him and his staff, of course. His staff is awesome also. But Dr. Shelby is a doctor anybody would want to have.
I'm working here in the clinic because it is the most meaningful work you can imagine. You really make a difference and create a difference in the patients that you see. You're changing people's life. You're switching people, to be on the right track. Many patients, they come to us here, they're not doing well with their diet, they're not doing well with taking their medicine, but after they've been with us, they totally different outcome compared with before.
I actually have a great deal of fun with my job in terms of being Chief Executive Officer of this organization because of the staff, because of the commitment that they have, because of their forward thinking and their willingness to go the extra mile, because of the love they have for the patients that come to them and meeting the needs of the community. Much of the time when we talk about our patients, we go beyond just talking about what their immediate needs are, but in terms of how they need to improve in one area of their lifestyle, or what can be given to them in terms of meeting their needs and improving their overall lives. We're looking to improve the quality of their life, and I think everyone in this organization has that to heart. They're very committed to that and work very hard to making sure that the patients understand that they're there for them and are willing to do that, whatever it takes.